Abdangan saya is in Nagaland TV, some manulaga was. Aman ita yere Kohima de old NST de aginase, yere Crescent International Hotel or Restaurant de aginase. Aji All Nagaland Pharmacy Association ba press conference karne matigina ase. To ahibi amakan jagine sai sabo takan government laga nutun policy laga upore kotha kole ase kuche. To itu laga upore ki koy amakan Iti amagan yere All Nagaland Pharmacy Association laga General Secretary Limayangar Jamir logore ase. Sir, apnagan itu license to isugule government prahe apnagan ki dise kuchi na. So itu laga do isugule do license to kitia dise aro valid ase na nai tebi itu license to government pra itu laga registration license registration garni bi fee kiman duise aro ita retention kura laga upori bi tahan kina yearly loina monthly loina kine ase itu laga upore.
Moen itu na license to ile department by issue gure for 5 years. 5 years nimede issue gure. At first time they license apply gura them de then bar certain amount mangi. Na certain amount mangi do moen itu tirai de. Itu tirai de bichide license acquire gura bichide moen la business to run gure. Every 5 years moen itu kiba hoje. Itu renew gurna jay. Renewal la fee doile through treasury chalan. Through treasury chalan moen chalan katina lui jabo ina na renew kurina ase. Na bolibi yade ekta moi stress kole mon jado ekta ina ase. Then first license issue kura dem de qualified persons kan do tain ba de. Tain ba de. To itu tain ki sapra dise itu moen doile idula face speed na jane bolibi tain ba nam dise moen itui jolai na ase. Na ite jane ase moen asol do law hisab di doile moen pharmacist ke tarla certificate kan lui jay na tainke application dia dem di to submit kuro lage. However, department never ask us to produce that certificate. Tain bari idu technician la name, pharmacist la name or tarla registration kan do tain ba hali di na moen ge di na idula practice kuri na ise. Another point I want to make is department ba 2021 or 2020, time kita 2020, 21 July ase whatever it is. Time ba guadole utu time ba notification di na itu qualified pharmacist to ji hulibi rakhibo lage. Aru itu implement gurule ase goina taigan itu iman stress kuri ase dan. Oli moi yade question ekta gurule munjado yade retention certificate ekta ase yade retention certificate yade itu retention certificate to 2013 de renew 2023 de renew gurdise. Aro idula validity to 2028 ase. To department ba 2020-21 ba hi idu policy to implement gurule ase gushi gule to kina ona 2023 de idu retention dise na. Aro idu 2023 no 2024 de bi di na ase. New licenses be issue gona ase. To idu ba department ke question gora do tan la working to kina ase. Na department do certain section alag to action ki coordinate nukure na action bar ki gure ase action bar ki gure ase idu na jani na kure ase idu moen ekta question gole mon ase.
First of all, I'd like to thank God for this time that given to all of us. Today we are gathered here with the party of aggrieved All Nagaland Pharmacy Association. Today we are here to highlight some of our grievances to the government for what is happening around here in the many part of the social media. Also, I would like to thank the media friends for coming and covering up of this particular time. The reason that we are here is like we have got something to tell to this, even to the government and even to the public for what is happening here. The issues as they reach us, they have given the show cause notice in the year of 2021. So from 21 onwards, we are getting with these issues till today. We would like to make it very clear to the people of Nagaland that these issues is not only 5 years, 10 years. These issues has started from the time of since the existence of the Nagaland states. So it has got these 40, 50 years issues is there. Now, with this, the 40, 50 years of the issues that we have today, now these are the states is the shortage, the state is facing of this one, and where we have this from all over the 14 district, which is affiliate to our association today. And because of this, the transportation, because of this, the weather, the other district could not turn out. Only this around here could able to be here this morning. As we said earlier, these issues that we would like to let our, the people also to know, something like we are doing for the people of Nagas in general as a whole. We are not doing just for the business, but this is our service that we also been contributing to the society. Our contribute, instead of acknowledging of our contribution, now we are facing this kind of thing. Now many pharmacies across the states have been closed down because of the show cause notice and the cancellation order. In later on, all these details will be, briefing you. As we said earlier, these are some of the things that today we are here. So before we go further, I will give time to my secretary to highlight some of these the things which has been, the said and written for all of us today.
Okay, first of all, I'd like to thank the media fraternity for covering this event. Now, in the first place, we want to portray our grievances as well as our, the conclusion that we have come to after going through in-depth study of the matter. So I'll go through the points one by one. So, now we all know that in February 2025, the issue of closure of pharmacies without pharmacists came to the fore and caught widespread media coverage and scrutiny. There were many instances where the pharmacy community was demonized. We were even portrayed as running our pharmacies illegally, which is not factual. In fact, we are also a victim of the corrupt system. The general public as well as our media was made to consume only one side of the story. NBA could have, but chose not to react at that point of time. That is during February, March. Instead, we decided to have an in-depth study of the ground reality as well as the implications of the department's action on the overall health sector of our state. Now, I want to stress on this because in the tussle between the department and the pharmacy community, it will be the general public that will suffer. That is the point I want to stress. Now, at the present point of time, NBA has done our bit. We have called this press conference so as to provide facts and figures and our side of the story for public consumption and cognizance by the Department of Health and Family Welfare as well as the Government of India. Now, I have said that we are also a victim of the corrupt system. Now, why I'm saying this is the point. Now, how the pharmacies are run in Nagaland? How are the pharmacies run in Nagaland? Because it is not a vegetable shop. It's not a vegetable shop, so we cannot just blindly open a pharmacy. There are certain systems we have to follow. Now, the procedure that is in the system that is being followed by the department is our pharmacy licenses are issued by the Health and Family Welfare Department, wherein they provided the name of the registered pharmacist and their registration number. We were asked to pay a certain amount for the license which each licensee has paid. Then the licenses were renewed after every 5 years. Renewal fees are charged from each licensee. This process has continued till the early part of 2024. Now, moi ade kiba ita ko muna je. Moi ade license ikta thikai dibo. Itu license te apni video bar cover group monchale dibi, that will be very good. Yate department ba dia dole SR Chaudhary is the pharmacist. person qualified in charge to look after this pharmacy. His registration number is 334. Now system to kina thakise gole do we are laymen. One layman ase. Our when bra jania taktu ele Department of Health and Family Welfare bra moenge edo pharmacy license to di when one jani luise. So what we did is when application likhina jena department ge we ask for a license, a pharmacy license. When jena edo dise department bra ki korise tayan bra edo ready kori dise aro after a few days all of tin bichide avni la license to ready hoiside lo lebi ina hoise acha ona moen jaise jaina moen license utha demde license la fee do ile iman hobo de ina hoise moen edo di dise. Now department bra moen ide jani ase de moen ide jani ase. The actual system is when apply gura demne moen asol do ile moen pharmacist la certificate luena jabo lage. Department never ask us for a certificate. Holy then nami likhina disido to moen to bhabise maybe the department assigns someone to look after our pharmacies. To moen to itu follow guse. Ina ona moen pharmacy to run guri wana ise. That is the reason why I'm saying that our business is not illegal. We have been running our pharmacies legally. Legally run guri ase moen. The other point I want to stress is, Aunian Median Bravi Janina as a general public by Janina as a department is claiming that since 2020 by Itulan notice to Tiasuru Uzi. Holibi Muen Pharmacy Community Land Knowledge Tiduele, the first notification we got was in September of 2021. 2021. Yade, I want everyone to think about this. I have a retention certificate in my hand. This is the retention certificate of a certain pharmacy that is provided by the department. Now, itula retention certificate to it was given in 2023, and this license is valid till December of 2028. To department do 2021, 2020 ba itula pharmacy pon gole pharmacist to mandatory hobo when aten janina asugule do. Why did they issue it? It retention certificate as there. They issued new pharmacy licenses even in 2024. Now, how is the department functioning? It was a big question that is the reason why we are saying we are a victim of the system. We are a victim of the system. The other point I want to stress is Department of Health and Family Welfare started issuing orders to the pharmacies to appoint a registered pharmacist in the later part of 2021. Pharmacists in Nagaland took cognizance of the order and hence pharmacy union was formed in each district and efforts were made to appoint registered pharmacists, and at the same time representations were submitted to the department citing the difficulties faced by the pharmacists due to the shortage of qualified pharmacists and appealing for extension of time. When get 2 months, 3 months in a department extension to elect. Of course, that part we acknowledge. But when the department started implementing the policy with earnestness, the need for a state-level association was felt necessary, and hence, All Nagaland Pharmacy Association was formed on the 13th of March 2025. Yade ekta when clarify gurule munjado, itula issue nula daktuele Nagaland pharmacies kan la affairs kan doile Nagaland Medical Dealers Association bra so side heije. But when this issue came to the fore, when NMD give one approach kurise, but then la initiative to we were not satisfied. They didn't even call for a single consultative meeting of the other districts. So what happened was that the issue was going on. The closure of pharmacy was at hand. So what we decided was that we have to stand on our own. Itula understanding bra on the initiative of Kohima Pharmacy Union when state kangi mati luise inauna Nagaland All Nagaland Pharmacy Association do 13 March 2025 the form gurise. Still now Dimapur Chumakutima aro Newland duile NMDA bai rukhai na ase. They are unable to join us. But we want to send this message to the NMDA that we have no differences with NMDA. Our goal is the same. So that is the reason why we appeal to NMDA that it will be much, much better for all the pharmacy community if we can work together. When it will message be portrayed, now NMDA form gura bichide when NMDA ba kam gura kunuba ina ase. NMDA as a first step approached the department and submitted a representation to the principal director and the controlling and licensing authority, praying for a reasonable extension of time, but the answer we got was negative. Therefore, we decided to approach both the department as well as the government. We therefore submitted another representation to the Commissioner and Secretary, Health and Family Welfare, but again, the response was negative. Then, we have submitted a representation to our Honorable Chief Minister of Nagaland, and the response is still awaited. We have also approached our Honorable Minister, Health and Family Welfare, but we were denied appointment. We therefore sent a representation to the stenographer to our Honorable Minister. When Pabiche Health and Family Welfare Law Minister to since he represents the whole Nagaland, we thought that he will be the right person to approach. Ito when man approach ko try guche. He is reluctant to give us appointment. Even his senior BS is reluctant to meet us. Maybe they are too occupied with some other works. We do not know. But I think we expect our concerned minister to at least meet us and hear our grievances, whatever be the outcome. We have also been trying to meet our chief secretary, but is yet to get an appointment. Chief Secretary, we want Bishivar Lopole try Guriaze, Polivi appointment netiginaze. Now, at the same time, when itu kure nuena representation kani dia nuena on an individual capacity as well as organizational capacity, when pharmacists to appoint globally try Guriaze. When action ki motop kure na appoint globally try Guriaze, but the fact is, Nagaland does not have pharmacists. Nagaland does not have pharmacists. I will come to that point later on in more detail. Holibi muen achidak TV muen pichijun successfully employed gurnazide muen achidak TV. We are putting in our efforts. Now the department at some point of time has claimed that we never took cognizance of their notice. No, we have taken it very seriously. We have taken it very seriously. That is the reason why organizations were formed. And we are putting in efforts. We are putting in efforts. Holibi subji na thaya na mansun na bagay na mansun lode bat khabi bole do ito to pishi problem dangor hwa nisina ho jise moen la problem do. We don't have qualified pharmacists in our state. Enough pinogo. We don't have qualified pharmacists in our state. So itulah situation ekta de they are forcing us to employ a registered pharmacist at any cost. Now, how do we go about? Are we ready? One point ekta bi stress kuruli munjadule. If the department can, think about the matter seriously, and since we are also stakeholders, if they can invite us, maybe together we can come up with a workable solution. That is also an appeal to the Department of Health and Family Welfare. Now, the other point I want to stress upon is ANPA fully understands the requirements mandated by law and we are willing to abide by it. When pharmacists narakibo guanuide, now only we are coming to know that mandatory as a pharmacist to rakibo lage. Well, we want to employ the pharmacists. But give us some solutions. That is what we are asking. That is what we are asking the department. Now, this is also very important. See, Nagaland being the only state in India without a pharmacy institute is faced with acute shortage of qualified pharmacists.
India being a developed country with inadequate manpower to mitigate the shortfall of qualified pharmacists has even introduced diploma and pharmacy courses, but still cannot produce enough pharmacists. Moreover, no state in India has thus far successfully implemented this policy. In fact, according to our controlling and licensing authority, Nagaland is the first state trying to implement this policy. Now, yadi ekta khuta aje. Nagaland even union directories to be soap the pharmacy institute aje. Nagaland is the only state in India which doesn't have even a single pharmacy institute. And even the Nagaland government is unable to send adequate number of students to study pharmacy courses on government quota. Now, what is their plan of action? How do they mitigate the problem? Because they know very well that there's a problem. But we don't see any efforts on the part of the department as well as the government of Nagaland to mitigate this problem. Sabi, advanced countries can, European countries can kikian dito diploma in pharmacy no loide. Tan la minimum qualification to ile bachelor's in pharmacy aje. Holi India dito manpower nai do. India is still a developing country. We don't have enough manpower. Ito ba then pharmacy diploma in pharmacy course be introduced kori dise. But still shortfall do ile bishi aje. Other states, ajikali to Google kursi ile so pachani lo. Alag states can de saisi kuli do Andhra Pradesh, Maharashtra and ladi saisi 50-60 institutes. There are 50-60 institutes in those states. How many pharmacies are they producing each year? Nagaland is the only state without a pharmacy institute. To government la plan of action to be kiya. Our still other states can do one pharmacy institute thagilibi then itula policy to implement go na parnas de. No state has successfully implemented this policy. In fact, in some states the matter has been litigated. It is under litigation. To Nagaland to itula condition ekta de asigusi our controlling and licensing authority has proudly told us that Nagaland is the first state to try to implement this policy. Are we in a position to implement this policy? I think it's a big question that the public deserves an answer. The public deserves an answer to this. Now, if you look at the ground reality based on various data, the ratio of pharmacists in Nagaland to the number of pharmacies in Nagaland to the number of registered pharmacies is quite disproportionate. As per the data provided by the department and published by the Nagaland Post on the 14th of February 2025, there are 1,157 pharmacies in Nagaland. Ito pharmacy khuli na thani azide. License lui na pharmacy no khulian do kiman 1,000 ho ito do when kuwana paro. Ito do data collect kursi do. I don't think it will be a small number. Whereas there are only 278 registered pharmacies according to the Department of Health and Family Welfare. Now, let's work it out. Tayan ba Nagaland Post kuha isap dito, aro Nagaland Post publish kuha isap dito, 1,157 operational pharmacies in Nagaland. Whereas tayan ba data provide kuha dito 278 registered pharmacies in Nagaland. Out of 278, 252 the government employees are there. So government employees cannot run a pharmacy. So let's put them out of the picture. Now how much are we left? We have 26 pharmacies left in Nagaland to look after 1,157 pharmacies. Ito point, ito iktase. When la grievances be ito ase. The other point, I think this is very important. Impact of the policy on the public health sector. NBA, after thorough analysis of the ground realities of the view that if the government is to implement this policy in its entirety, will put the public health sector in complete disarray. Here are some data in support of our views and for the consumption of both the general public as well as the department. Even in Kohima, the state capital, some colonies like AG, Merilica, Leri, etc. will be left without a single pharmacy. Pabi sabi to moan Kohima la gwezi de. Aro AG colony do largest colony in Kohima. Government by pharmacy sob to shut down kori disi koli do. Leri di do ekta pharmacy bi napachibo, Merilica di bi ekta pharmacy bi napachibo, AG colony di bi ekta pharmacy bi napachibo. To itya stop ekta 18 rupees for kiniwole colony la pharmacy di kini tha do. The nearest place they can go is Pier Hill. Just think of the inconveniences caused to the public. Our rati bimar ekta hosi kiba ekta hosi ule. Even basic medicines bi dibo na parule. Even a simple headache, probably manu muri jede. Holibi suddenly rati di bimar hosi ule do. To kut par lobo. Morning noha dak isorge morom bramugi morning dak no murai diwide wena rukhai wona ge. Ito last situation ekta de ase. That is about Kohima. Let's look at the data of some districts. Meluri, Shamator, Peg. Meluri di presently 6 pharmacies ase. Pharmacy choita ase. Tate ekta bi registered pharmacist nai. Shamator di 4ta pharmacy ase. Ekta bi registered pharmacist nai. Peg district de 34 pharmacies ase. Tate 2ta in-service pharmacies ase. So in-service pharmacies kan to tayo la license to cancel korbo lage. So just think about this. Meluri, Shamator, Peg kan to ile whole district without a single pharmacy run guru le ase. Public la health to kila position ekta de rakhi diwo. To ito district headquarter kan la ase. Now think about the subdivisions and rural areas. There will be complete chaos. There will be complete chaos. Now we want to ask the department, the wider question is the department in a position to fill the vacuum? Tayo pharmacy so bon godubo. To tayo la policy to kiya siya. We're going to close down all the pharmacies, and in the meantime we are going to do this so that the public doesn't suffer. Tayo ito la point of action ektabi asina ne. Tayo la concrete policy ektabi asina ne. I don't think so. Now, another point we wish to stress upon is that there is no case in Nagaland where a patient's life was either lost or put in jeopardy because of wrong medications administered by any pharmacy. In fact, everyone must refresh our memory and think of the services provided by the pharmacists during the recent pandemic, that is, COVID-19 pandemic, when the department or the government was in no position to even provide basic medicines to the general public. Now, at that point of time, the burden and responsibility was borne by the same pharmacies that the government and the department is trying to shut down. Ito to one so public, general public bi hobi kun brabi nohoi go na parbo. COVID-19 to kila situation thai je. Pharmacy and thakya gule kuti jawo thai je. Was the government even in a position to provide even basic medicines? No. What if another pandemic comes? Transition to smooth ho lage do. Transition has to be smooth. There must be a solution. There must be a solution. Of course, we are not saying that the policy is bad. Nagaland has to move forward. Nagaland has to move forward. So, of course, changes has to be brought about. But these kind of drastic decisions will put a huge vacuum in the public health sector. That is what we are observing. Now, the other point is, health is a state subject as per the constitutional provisions, meaning any state can frame health policies that is relevant and applicable to their state. Then the question is the government of Nagaland and the Department of Health and Family Welfare Department equipped adequately to step in and fill the void?
Now, I want to ask the department, do we even have a Nagaland-specific health policy? If there is, make it known to the public. But I think the answer is a big no. Our government is unable even to appoint qualified pharmacists in all the government-run health units. Now I want to provide some data here. Public health units, government-run public health units, TV department ba pharmacists, sufficient pharmacists appoint guru na parina asde. Mon district ekbar sabo, sub district na sabo oli moi kunuwa district la data di dibo. Mon district e Shangniu, Oting, Wanjing, Anpa, Mopong, Yongkao, TTC Mon. Itu ande government ba registered pharmacists appoint guru na parina asde. Pek district e wo. Semo Pek, Chief Medical Officer Pek TBA, only 2 pharmacists are there, whereas the sanctioned post is 3. Tadi pesa choto, Tetsome, Kuzame, pharmacist 9. Public health units to Kulise Olivi, pharmacist appoint gorne. Meluri di ekpar sawa. Por, Lepori, Baziho, Akiko, Sitze, Hutze, pharmacist 9. So if the government, if even the government is unable to appoint adequate number of registered pharmacists, time be solution to ki diya je. So in the meantime, what the government is doing is to solve the problem. What the department does is to impart a 3 months training to the nurses, and now the nurses are dispensing medicines to the patients. Should the same yardstick not be applied to both the pharmacies as well as the government-run public health units? To tayo na public health units, the pharmacists appoint guru na pariyaba 3 months training course di na nurses can give medicine di wuli diya siguli do. They are not registered pharmacists. Should the same yardstick not be followed to both the pharmacies as well as to the public health units? Time be the pharmacist na thagya ba appoint guru na pare na sinagi. To tardo appoint guru na pare aru moen kita job por justi apuni ando kut prahuli appoint guru lage. Itu ekta aside. Now, NBA is of the opinion that the department can come up with such programs if they have the will and are concerned about the public health. Kung natin, certain policy, state-specific policy kuno ba frame guru na. In the meantime, when shortage of pharmacists face growth to ekta certain policy implement guru na. Let the transition be smooth. Now, in conclusion, NBA is not against the department or the policy in question. But we are of the opinion that Nagaland is not equipped to implement this health policy at the present point of time. We are hopeful that the department would come up with some workable arrangements till such time our state will have pharmacy institutes and sufficient qualified manpower to provide healthcare to the general public unhindered. In the meantime, we appeal to the department as well as the government to allow us to operate our pharmacies till such time the department comes up with a concrete health policy that is relevant to our state and that the public health care is not left in a vacuum. We assure that on our part, all out efforts, both individually and on an organizational capacity, shall be made to employ a qualified registered pharmacist. So, when in conclusion, when last day we appeal gurule monaje, when we try nukuranwe, we have done our best, we are trying our best, and we shall put in extra efforts in the days to come. But we want both the general public as well as the Department of Health and Family Welfare as well as the government of Nagaland to look into the matter seriously to look into the matter seriously and come up with a workable solution for the interim period till such time when we have enough pharmacies to take the mantle, so that the transition will be smooth, the public will not suffer, and everyone, irrespective of whether someone lives in the cities, towns, or rural areas, will get at least basic medical service. That is what we appeal to our department. Now, thank you to our media fraternity for your patient hearing. Now I'll open the time for Q&A.
You have mentioned that the government is unable to appoint qualified pharmacists.
Yeah.
And you have also stated that there is a lack of qualified pharmacists.
Yeah.
So what could be the reason behind it? Is there a lack of interest or some other reasons that we don't have qualified pharmacists?
No, that is the reason why I've provided some figures also. See, first thing is our state needs institutes to produce enough pharmacists. Our state needs enough pharmacists. Now, institute থাকিব লাগে তো, institute pharmacist, qualified pharmacist can pass out কৰিব লাগে তো, না হয় না নহয়, হলি state একটা institute পি নাই pharmacist institute. Government at the most they can send is each year state la kota di 5 জন 6 জন ki pharmacy la courses puribole bhotai ase to na. So every year government, let's say that every year government is producing 5-10 pharmacists. Holibi at the same time itia pharmacists thakia to be retire bi hoye ase muri ase to. The number is not increasing. It was a problem though. Pharmacists nai. We have inadequate qualified registered pharmacists. That is the main problem. It's not that we don't want to employ. We want to employ. We want to save our business. Because this is not just business. Okay, of course, there might be some rotten apples. Rotten apples can be thakiboda moenla community dibi. We are not denying that. Holy most of us, moenbi itula business run gurado, it is for our sustenance. When itu why family survive kriyaje. On top of that, we are also providing service. When it be as there, when la bhavanabi, this is unlike other business. This is an ethical business. When itula thought pukina when kuride, holibi itiaduele thousands of families are dislocated. Thousands of families are dislocated. Actually, inase, when kwanisina. Nagaland de first place by department by edu strictly implement korna IC walido, no pharmacy would have been running without a registered pharmacist. Moi kwa nisina department by edu license ready-made license disido moinge. Na, of course we were ignorant of the law. We admit that part, and ignorance is not an excuse. We also accept that. That was the system. That was the system. Because Nagaland de pharmacist na thakya right and pharmacy license to it dian hoina tan tribunal na bi gushina Nagaland DV ba ekta interview lo adem de controlling and licensing authority ba bi gushe. Tribunal form gorna then based on experiences. 5 years experience, 10 years experience itu ange tan kiba bi dishe. Pharmacist certificate dishe. They were appointed as pharmacists, as registered pharmacists. Paramedical Institute TV 2 years course introduced kursi then. In our it's not diploma okay. Certain policy in our then it mitigate grow nimidi tatibabi they produce a huge number of pharmacists through that course. In our Julina isu to government dakpabi itu kurise. To pharmacy to pharmacies can be run globally though, out of question. So presently, most of the pharmacies are running without pharmacists. It's either based on experience. Bishiwala do ile ekta pharmacy de buibo, tadiba experience gain grow, doctor no de gain grow. Ina wana self-taught as self-taught as. That is how our system is running. Nay, ito na. Inaikta ase. Like you pointed out, we are asking for extension of time na. In the meantime also, we are not just going, when China any representation din, we sit with them. We try to talk to them. We try to talk to them. When the time buchubuna ke idulabi when approach Korea. Now, in the meantime, when la expectation be idwe let's come up, let's sit together. Ikilo buiwo jalna. Let's discuss the matter. Let's discuss the matter in depth. Aro ekta solution ekta anibo try go jalna. Kile mani sabi. Itya Nagaland de 700, 800, 900 pharmacy pon gurisi golido. Ultimately public is suffer go. Na public is suffer go. Ito ba, yes, we need to move forward. We need to move forward. Kwan isina Nagaland bi, buila ina thagise, when buila ba ina thagise, itula system di thagibo ito noy. We need to move forward. Holi bi, ekta move forward kuruli do, government bi, come on, let's sit together. Ekta transition kuruli do, ekta chalna, ekta solution, ekta bisarabo chalna. Na, let the transition be smooth. In the meantime, when we pariadak research pharmacists to employ gurbo. Na, our department ravi, come on, do your best. Bring pharmacy institutes. Ek time when a tuita dinda ajikali to private institutes can be anibo barbo. Anina institute ek time when a chalna alag state can be pit kona pasta chuita anina. Ina ona produce enough pharmacists so that the transition will be smooth. If and when the government comes with such a policy, and if and when the state will have enough pharmacies, we don't need the government to ask us to tell us to close down our shops. We will shut down our shops on our own, voluntarily.
Adding to that, itu pharmacist to shortage hwa lagama jodi bi ita do ami khan ki communicate kura do bahar bra itu pharmacist kan anya khan to itu bi bon ho jasi ita do ite bi konti nai bi nai ini ka hwa ma jodi ita do apni bahar bra bi pura man bi certificate bi ani kine cholibo na parebo to ami khan ko to bra cholibo ami khan itu karne agide sadi ko ani sina ami khan to gor to department ki ko bole mon thakya to itu time do aro extend korbi na iniga hoshigule ami khambi itu time de kiniga hole de parebo itu la bi bisarebo do iniga bi na hole ami khambi kiniga gurubo ami kan aji du iniga ho jese itu bara aji du sob ai gini iniga ko tha koras de bisarebo ami kan
Tai Tadina tadi moi ikta point ikta stress korli monaje moi kan of course when kiba graduli na ase when extension of time mangiase it weekta so that we will hunt further na we will hunt for pharmacists decision payase de achibi kalibi ekjon duijon do ini pai na na ina ona decision payase de babi aro when department ki approach kujo sabi itula problem ase there is shortage of pharmacies why not in the meantime awanian chalna ekta come up with certain courses na ekta course ekta kiba ekta introduce ko na onian ina usigule we are even willing to pay for that course na we are even willing to pay bear the burden holibe transition ko ule do we are also losing our livelihood that is also one thing of course that is not the main point we are stressing upon but kwan isina solution to bisarwo nimide ekta course can be introduced kurilibi ki chai kwan isina department by pharmacist appoint group na pariaba 3 months training course di na nurse kan ge PhD de tawai dibo di asido na to if the government can come up with such kind of policies for a certain period of time we are not asking for 20-30 years okay we are not asking for 10-20 years holibe any few years nimide ekta transition group nimide ina ekta kuribina ina husigule do our state will also have enough pharmacies in the meantime na aru when nimide holibe when la livelihood ase itia itu la business to na when la livelihood pi ase to husigule do when yolo time disibule when bi pharmacist appoint group parle group no isi golibi moin bi alag business kandi golibi transition group le na transition period to olop extend goribi na itu go ase moin gwa le. No, we are not demanding for 3 years, 5 years, or 10 years. But we are appealing to the department to give us a reasonable period of time. Reasonable.
So what is that reasonable period of time according to your association?
That is what we are saying.
Until such time, the government is ready with the qualified pharmacists. Because I just want to come in here. Pharmacy among Kenya run how you are running without qualified pharmacy. We also admit that we are running pharmacy without qualified pharmacists. Will it be necessity is the matter of invention, one is not the needs of the hour, the needs of the time. Compel us to choose this profession. This pharmacy is a novel profession. Just jump into this profession. Will you be looking to expect the needs of the town, the needs of the area, our area? Pharmacy nine, I myself will suffer. So why not we find some solution? Medical field is medical company they can for I'm just taking an example. For a few years, then I got experience in medical things, then left that company and back home and started pharmacy. So in Bosti Manuki, still now I'm running more than 20 years I'm running pharmacy. So experience with that. Though I don't have that qualified pharmacist qualified means certificate, not a pharmacy holder, certificate holder. Likewise, everyone has their own story. How we are come into this pharmacy profession. Itu need based amana ina join kunatani. Also, it is pharmacy. Former speaker doesn't. So, Balbra with details about to explain. We are not just doing a business here. We are also trying to bring some change and try to help to serve the people. Pharmacy business it is something like not like other business. Itu karena amon aru apnikan ni jani they are just compare with other business. Pharmacy business is running with full discipline. Our rules and regulations bisi Today we'll have to maintain the stocks, temperature, guidelines. We are observing, we are following, we are obeying all the rules and regulations. Inya guna thakatu itya mohan ki itulaga issue ulai dia tu actually it is not an issue. Yade public here misunderstanding present. Olivi American it is not that we are cooperating with the department also. We are trying to cooperate with the department. Olivi that here is department ko to mohan ke your pharmacy cannot be run without pharmacists, experienced pharmacy, and it's a qualified pharmacist. So, documents, everything is perfect. The license were issued by the department only. So, among Google, the criminal is not treated. So, among we don't have a pharmacist. And we are also trying to bring out, to come with the pharmacists, and we are only beside to state among Nagaland state la conditions I see ite tali pula number to go this ground ready to this I see we don't have a pharmacist qualified pharmacist na thaka to alap thagi 278 dikhai ase itu ba bi bisi ko diyo right only one figure part to paise to ta kan ni maximum to ta kan government employee ase na pura 26 month paise 26 itu bi to ta kan master in pharmacist doctor in pharmacist ground ase they will go for another job so pharmacy de boy one 7-8 lakhs खर्चा करना किन्या pharmacist तो एक तरह बोलने मन हो तो इतो करने ताकि willingly ना है तो हमारा state अमान बिचारे से ना पाए तो इतो बड़ा ठीक है से इदिका होले कोई ना अमान दोसरा state भी अमान convince कुड़ा आनी बोले कुछ ताकि मैं आये बोले मन ना है भी convince कुड़ा आये बोले बंदे again the department said we not enough from outside तो where do we go इदिका से अब ठीक है से तो pharmacy is not the only way of survival तो अमान बंद कुछ बोले public to suffer करो तो अब बंद कर देबो या ताइ बंद कर देबो सब बंद करसे बोले कुन सफर होगा दिया न दे हम सब पब्लिक सफर हो तो किले बोले इतिहास अभी किने का उपाय एकता पुरना भी अब नेन से बोले ग्री गर्न दे मन डॉक्यूमेंट्स लगिना फार्मासिस्ट लगा एदु डिग्री होल्डर गन डी फार्म वाला सर्टिफिकेट तो लगिना हैंग करना से दुकान के only with the person is not going to sit in the pharmacy all the same person is dealing with the medicine only the certificate is hanging in the pharmacy is best no तो इतो justify group बड़ा मान इतो नहीं तो इतो बड़ा मोई को तो मुझे interest नहीं तो group में दाइना मोई नहीं को नहीं मोई ना पढ़े को नहीं चाहिए तो बोली भी Itu jagina bisaribo pharmacist bisarina anibo tade hang kurubo itu manuke I'll have to pay another 10, 15 to 20,000 extra for that documents only. Whereas the person is not willing to see, you know. Aru ni boabi na boibo ne. Itia tagi ese boabi Dimapur Jumu itu area sabi. Bisi baktu itu just certificate hanging there. The person not there. India la context India condition. So ground ready to sign na kam kurubo lagi. Now department kya moi kole mandu they don't have to run corner to corner. They don't have to enforcing this. Itu nakuribi corner lagi. Iman dukpi kurul kam na. Jadi government para diploma dosra B farm na holibi at least diploma institute nisna ekta state ke ani shekule. Every year 200, 100, 200 pass out kuri shekule. Within 2 years diploma course 2 years ase. So 2 years te 200, 200, 300 ase. Within 4, 5 years te pharmacy se borta ho jabo diploma korina. Tai khan nije he bisare kina jai ai jabo pharmacy de. We don't have to go looking for them. They themselves come. Paro pharmacy de occupy kuro. So idikala situation na hatok tu itu act to fully implement kule aware with nature thase mona state la condition de. So government mi dara weakness to jani bolage. Khali pharmacy ke blame korina. Aro public khan na jane pharmacies khan sab bon kori debe. Itu khan ko kam nai. Na jana hane poisi tu koibi. Kun te at the end of the kun suffer kuro. Public ke suffer kuro. Amola district ke dia ko college na there are 8 health center. Community health center. Ajikali health and welfare center ko. 18 district 18 sub centers. Tadibi they are supposed to be pharmacists takibola. We are not condemning that GNM Kurikina Takakan they are not qualified. They are qualified in their field, but they are not supposed to handle the medicine as per the Act. The medicine dispense group of only pharmacy here boys, no. So it is nurse can be from like BSc nursing Gurina, MSc nursing Gurina Takan. I can qualified as Tahani, they are by the Act, they don't allow. They don't allow to handle the medicine though. It was it to I to strictly follow Guru stop the loophole. It took Amohan 20, 30 years experience with medicine deal with Takamuno just shut down Ruby with an Ruby. It took prototype no. Will be Sabi, analyze Ruby, authenticate Ruby, Paramanukitu, Ekta, situation, Ekta condition, they are Nigana, run Ruby. So in the until such time that Amohana state. Itu pharmacies ready for gina institute ani gina to ready no atok to itu act to fully implement no prile bahala se ekta bridge bangawo kole to alternative age bisare to age bridge bangai dile kina gari jabo alternative route age bisare bina to alternative to rakhi gina itu bridge bangai na ten manubi to no itu nisna amon itu fully implement grow kole to itu age ekta alternative bisare bina koi dibo to manubi ready astos itu garne ko ase public hamni itu jani bola
Komba laga PSC khande government appointees ase holibi general public khane buhi ase takhan to appointment to ekta alag bohadu manu alag iniga laga bi mohala evidence ase mohal lagode na government tu kitia itu department itu lagi se kole mohan itu khan sob ready ase ami khan takhan logode ki bishi hudise ami khan department logode ki niga kurele bol hobo lekha lekhi ami khan logode bishi ase de itu khandu department ke dise department ke itu khan bi answer mohan ke dibi itu khandu mohan itu khan lage department para tu tahan la phale bari information dia se tahan dia laga aru kwala do Allah ko jese newspaper de goje more than 300-400 unemployed pharmacies ase 300 bi punche no according to department ratio to ami khandu ko de jabu ite du tahan action aibo kiba kibi likhi ne public ke pakala kori dibo itu laga na hoy do ite do ba bara agi de condition na ba bara kuri gene ami kan last state to forward kurubole laga time moje itu bara ami kan aji yete thagya do agi de kuse ami kan do department laga against nai de ami kan bi kurubole ase holi bi kinika bisari bo rasta ami kan ge bi dekabi aru ami kan ge bi mondo kuribi to ale ami kan de department mara mohang ne expenditure bear kuribi ko na hoy do rasta kan ami kan ge dekabi to ami kan bi bisari bo kurubo do Holibi kwanis na ite duini ko je to ami hamko de jabo imam family du ko de jabo ini ka concern thagya bra aji ami kan ide haiside
moi ganna odula question de previous question de moi ta answer dibo mon jado na we are not asking for a specific period of time we are asking for a reasonable extension of time Moen kile reasonable do kuisi boli do moen kwan isina we are all stakeholders. There. Moen ki ita pon ko disi boli bi that is not the solution. Public suffer gruwa. To moen reasonable solution ekta do moen la opinion didu ina ase. We are all stakeholders. Pharmacy community, department, medical experts. We have medical experts in the field of medicine in Nagaland also. If necessary, invite from outside. In Abiguana, let's sit together, look at the ground reality. Na, what is the reality in our state? Itu ek par sabo chalna. In our government, come up with a policy. Policy ekta anibe. Sabi, 5 years tak dito mo institute iman kiba kuri dibo, ina kuri dibo. Mo itu solution ani dibo. Ina ekta kuri na ikilo de workout kursi bole the public will not suffer. Transition will be smooth. Our state will also move ahead. Itu aside kota do. Itu noisi bole do itiala do solution no do. Of course, we'll lose our business. That is also one thing. Let's leave it. Only public to moen kohima de dimabor kandi thakiano na idu iman seriously do na phabi uli phabi. Only we moi itia figures ko nuwa dia din nisina sabi do. Meluri district ti choita pharmacy thagisi ekta bi pharmacist nai, so all the 6 pharmacies will be closed down. On top of that, public health units TV 1, 2, 3, 4, 5, 6 choita ti do nai. Ar sub village ti do public health units bi nai. To usigole Meluri gando ile matha phika asigole chal kare hayo ribe. Phekti tawai ginule jabo. Phekti bi pharmacy bajugo na bajugo ki jane. To chal na ina nukuribo. Na public bi suffer nukuribo. Ina na solution, permanent solution ekta bisar boli do. I think it's up to the department. And that will be our reasonable period of time. The solution that they come up with. The solution, the road map that the department comes up with will be the reasonable period of time for us. As of now, we don't have any such plan of action. We are not going to come out on the streets. We are not going to resort to some violent actions. We are not going to resort to any violent actions. But we want to knock sense into the heads of the department officials as well as the government to face reality. Because Sadi Bhagwan Nishina, invention is the mother of needs. Na, according to our needs, we invent. Na, we innovate. To chal na ekta certain period of time. In the meantime, ekta workable solution ekta workout kuribi nagi. Itu appeal kuri ase. We still now we are only appealing.
We are not against the system. We are not against the department for what they are doing. We only request the government or the department to look beyond the words on the paper. It has a month. Hali paper to kill to implement na kuribo na ground reality sign. A monkey come behind us. Just see behind the hearts behind our work. Monkey come guna to be sawalan. Yes, we don't deny, as my former speaker has said, pharmacy among the Nije Prabi among the except number of pharmacy because it bring down our reproduction. Pharmacy that reproduce be turned down grade. Kile ABC medicine ABC bin kulang rubi asile. Will be out of 190% pharmacy with purpose, with reason clean at the They love background such as Baba, doctor, nurse, doctor, nursing home, like my friend, his father is doctor. Niga itula legishi doina kulabsi baksine. Aro mana manu bisi baksai gule. Amoy B farm corner, M farm corner will be through my experience, Amoy starting to do. Amoy kiman learn to this more it is, I think, good enough to at least educate people. Because if I am especially Naga people are very weak in this medical field. Mon doctorate kuna takilibi, engineer kuna takilibi, I know to medicine to time ki khai to na. Simple. We are trying our best to educate them. Aro kya sabi to danger. The danger when we talk about the pharmacy among pila kusi lebi among pra kunda ke the medicine wrong medication kuna murai ya na report na kali educated as far as possible we are trying to educate people from all over I have it Nagaland de sabi to covid ase porta ase covid ase la prescription loi na ahe ne dukan ki mana side to ekdam bhoy lagi amon to saina injection nandrolone steroid na triamcinolone injection every day once daily for 5 days dina anu itu medicine no to once in a week hardly it be patient la profile bhal pra saina dibula range covid hospital likina le lomba pura man de to patient ke anna man bhal bhaje patna kora banu ba likhi dise patna kora to kulise isor pra bal bole dawai na bani kuno umani ga exhibit kona bisi ba itu dibida painkiller komor bikhai se ki dido itu dimol dibito na Frenchta dibito maybe Flaxon dibito itu duita ki le loise duita ki lo khale ba moi to itu duita same medicine ase to ini amana ignorance bisi ase amon trying that our best itu medical doctor han pra only pharmacists kura kan pra so bosti bojina educate kura amon trying our best to educate these people sorry aros jodi sabo gole kile pharmacy ke sob target kore moi to pra koise pharmacy business to unless there is a good reason choose no kore so manura chukul chai to underground ni pharmacy ke target kore CSO kan bi so pharmacy so pharmacy to letra wan is na whereas bond para to discipline maintain kore to for pharmacy business to choose no kore unless there is a good reason kile gole amon dosra department han sachi gole Nagaland de easy ase dosra without discipline business run kora aro kobo gole danger la kode pharmacy garage la kota koi gari na garage de jaina sabi to kun pra kore mechanical engineer pra no kore to ekta ini pole ekta baidi gari bada to luxurious car kore dangerous na ta hanlo ki banai sin na sabo gole building RCC building agina asam bra khiti te hal mari mari na RCC building banai ase amon ki te bin sa to geotechnical laga kiba survey bi no kore or engineering analysis no kore na itu building kiman story uthabo itu building to dangerous na itu han field is abo kote danger la kota hoise dusra department bi bisi ase khali pharmacy to we are trying our best to follow with the rules go with the system khali the problem ase itu problem to the pharmacists nai aro itu bi amhan bi trying to cope with this follow cooperate kore ase only bi nai to materials nai equipments nai koti pra ani bo itu ase problem to understand kori bi itu ko ase
Kohimade 141 pharmacy ase dokan iman ase to iman de around 10 to attached to the like a hospital khan inga thake ase to the rest to iniga ase itu majode ta kan du gase ami khan ke tu iniga kurbi ko law is not only for us law also should be applied because according to the law like government kam kura mani itu kurba na pare whereas Kohima de sale de bishi bak to Kohima laga pharmacist teach kuri sabi itu han government employee da so to ta han du ko je apni khan tu qualified na ko apni khan tu tik na ko ami khan tu criminal nation na to ta khan tu ki ase mohan itu bi bujibo na pare itu bra ki karne ami khan ke ini ga pura se ho itu bi bujibo na pare iniga laga situation de thagi jaise to iniga laga situation de itia to according to this drugs controller laga office de saishukole to this June to last ho jaise to age de dekha nishina itu letter khan to validity to 28 tak ase mohan do paisa do validity to paisa 28 laga disi do komba du holibi itu khan bi thagili bi dikhili bi ita to cancellation order to sob logode Kohima de cancellation order pai jaise to iniga koche according to the drugs and cosmetic law apni itia dokan khulile 2 saal jail de jabo ide ho jaise to ami anko to khuli bolte to itu time na ami kan kini ga kurubo ami anko de jabo itu bi hudya je ami khan so bi akha gura je go itu department do ami khan laga pli bi huni gene ekta kiba ta understanding na higine kurili to beji balo bola na hole di further course do ami khan bi ki kurubo na jene hole bi ini ka bi hoji goli to ini kotha bra action ke respect kuri gene action ini ga kuri thagiala itu bi hona kule to opanai do na ini ga la situation bi aije mo no debi na itu bra ami khan department lo di bi ko bole mon thagya du ini ga na hogene ami khan ke check kura nijina ta han bi government employee kuri gene rang gura khan check kurbi na tan employee kuri gene money substitute kura khan rakhibi na for example Meluri employed pharmacies holibi tai pharmacist buhanai do dosara mane just merely graduate mane buya do ami kan itu kan la figure job district ami kan bisari ase kiman ase kiniga ase fake ase na nai office para paper de issue kura de hosa ase na nai mi kan dibi ase olibi tu kan me tabi tik nai to ami kan ge ko ase target tu kali ko himatao dimapur chumu iniga khane target kure what is to the rest of the district to kiman suffer kure ase ami kan tu kham sob sagine itu agide ko ani jina ahigine jama kure gene iniga hole tu na hobo ho janya je Nagaland organization bisi ho jaise ma bi tu du alchi lagi kintu itu compel ami kan ge compel kura bra ami kan iniga ho higine ajia higine ami kan rights to iniga ko asidi yes
No, we'll leave that answer to the department.
takani issue
But-
kure to tangi dibo
Ito license as a camera cover guru parle well and good. Well and good.
How much do they charge for registration? Maybe also know that amount is
Ito
varies from person to person.
Ito
So they give you.
ito inase.
uniform.
not
No,
uniform
no, no. Muy kwa ni sinana.
So there is a backdoor appointment kind of thing.
Obviously, right.
You admit that.
No, it's something like this. Something like this here. Yeah.
Even
Yeah.
if you are not a certified pharmacist.
Whether the department resorted to corrupt practice or not, we are not alleging anything. But we'll just leave the answer to the department.
the answer
But this is the fact. Moi itu license apply gura demde application ekta likhise jena department ke dise department ba odu din dai bidai guse chaise cha to dile itu license hand over guse yade SR Chautori aje tain bra itu qualified person tain bra designate kodisile tain bra di dise department bra
yes.
dise No. They are only now when it is there. We are supposed to, take the certificate as well as who knows, even the person concerned. Only department from Moenge Udu India Chase SR Chautori La Namdo Hali Dishe registration number 334 Halina Dishe. Department Edu Dishido. Na.
Why didn't you complain in
No, that was the system. Okay. And like I said, being laymen, okay? Being laymen, we are not familiar with all these legal,
terms
all these legal intricacies, let's say. So we got the license, we came back happily, we opened our shop, we didn't know that, but I even haven't seen who SR Jautori is. Not even in my dream. Only now I am coming to realize that, I have to produce that certificate also.
See, that may not be the same case in every person. Will be among to anibi badu criteria ekta fulfill kuru gane ana like among driving license kana ru ki banali residential permanent residential certificate no NOC anibi bonista. So those are the required documents you bring going out DC to amount to submit kuru. So will be at that time jidi takan pra without pharmacies cannot be run. Clear cut from day one. Takan pra ko DC kule. Amo thandi we could have go for another option. Pharmacy run gula chance na moi. Koina itu din bra mo to professionally choose ko para. Will be itu la to mangi ko na. Man to just to fulfill the criteria ekta ani bi ko ani se fulfill hoise amon ke authorize dise pharmacy khuli gula. Mola namte ase pharmacy bi. To thik ase khuli daga dinde 20 years or run gura pichite itu 20 years ko to ini no renew gura every 4 years to renew guri gina ahi ase. To renew gura dinde ko bi na. Next year to apni ke bon hobe ko na. Precaution no pai da. Guri na last day kun ba to 30 years run gura me 25 years run gura pichite apni ta qualified no hai ko to ki
latest renewal to it was a day last year January the latest itu we department ma renew gure laga se ami ka mara na hoy itu bi ase de itu department itu ka takani issue gure se oye first pale tu takan mohan na jani libi takan do jani asu do to ini ka hoje gule tu renew gura tam tam kan to ini na hobode boli to hoise do last year tabi na itu bi issue gure se to ite bi na তো ইস্যু করেছে আর ভং করেছে তো আমি কামি নাজানি হয়েছে ইটো ওরা ইটো খান আনসার টু ডিপার্টমেন্ট হে আনসার করিলে ভাল আমি কামি নাজানি ইটো কান
তাই কান 2020 de time to time then la kiba to change kuri de time la stance to change kuri de konoba dem di kwese then 2020 ba disi when stick kuri ase then konoba dem di kwese 2020 de newspaper de through newspaper then publish kuri dise but because of covid we then udula issue to les sideline korna ekbar rakhi thakise ina way ase holibi moan lo de personally ina una ahia dole 2021 September ra ase na idwa moan be paria ta kan do appoint gure ase do
মানুহ হে নাথাকিয়া বৰা কত বৰা নিব না কিমান পাছে ইমান তো কুৰাছে না হলিবি মানুহ হে নাথাকিয়া বৰা আমি কামি ইটো দি আনসার দিকিনি কা কব
লজিক তো কি আছে pharmacist to নাই no pharmacies cannot be run without pharmacists question only they are still issuing the license till 2024 aru di ase to ifale amohan bin napai na ase poila la issue video han bi debi napai na ase aru kile notun di ase to etu in proportionate ase to etu balance aina dibo lagi to pharmacists lagi gole pharmacists kiman ase Nagaland de takana report ase registered pharmacy because they didn't allow from outside state out of the state so it is very much in the record so they should know how many pharmacies are vacant na kiman pharmacies fill koribo paribo etu jani nai takan bi license bi dibo lagi ta only be number of license drugs license issue gradually to yede figure de 1157 ase only be actual lukaina borde poya bisi ase debi ko subject to 3-4,000 license bi issue guna ase ki kuna subject to le mantu ko na re kedi ga ase only be they run growth 1000 plus run kore so it took tv among we are running sort of this pharmacies qualified pharmacies
itu kan laga actual number kan janibo nimite ami kan kiman issue kuri dije itu kan actual number janibo nimite on they edura age de condition apni kan lagila ami kan logote na liso pasede itu kumpun kam de jaise kum khali ase kum murise kum badu mohan janya ase de ini lawi thakibo olibi condition ami kan itu kan ge kwa dole do ami kan bi ini ga je itu kone ekta understand gone kotha kurile beshi bal hobo iniga para department gi ko bole ma
further question na
it was only last week only verbally said to us yes
license chulao la diole la bola I'm really confused
itu pharmacies to bahar bara ani bole na kile mane pharmacies to or certificate to bahar bara ania to verbally it was talked to us last week only that you cannot bring any certificate from outside. Earlier it says that you can bring NOC. Only be it be bonus day. Itu kan do naubo. Abni kan itu apply ko dali naubo.
actually na system do ina jide ni for more clarity pharmacy license to twitter system aje ekta aje edo technical person to qualified pharmacist usually do he will apply for the license directly in his name that is technical person there alag to a firm aje firm means anyone can apply for a pharmacy license but he or she has to appoint a registered pharmacist so when la namdi khulina ase we have the right to get a license holibi point in question do le uto registered pharmacist to ase to manage the pharmacy yeah it was given by the department only
Many of the license holder do not know who is the pharmacist.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.